Hard cataract is something we all face in our day-to-day surgery. It is always very difficult trying to manage these hard cataracts. One of the area that we find most difficult is when we are trying to break the nucleus into number of pieces. It is sometimes very difficult to break the posterior plate of the nucleus, as it may be very hard or leathery. While trying to break the nucleus into small pieces, we may cause a break in the posterior capsule or can also cause zonular dialysis. Let us look into another case of a hard cataract. We can see that we have to do many maneuvers to break the cataract successfully without damaging the posterior capsule. It is always very dangerous to go deep into the nucleus, as we risk having a rent in the posterior capsule. Whatever technique we use, we need to go deep and very close to the posterior capsule, thereby having a risk of damaging the posterior capsule. I always thought it will be nice to have access to the posterior plate directly to the phaco tip. Since we cannot approach the posterior plate with the phaco tip, I thought, why not flip the nucleus? That is when I tried the somersault in a half piece of the nucleus of a hard cataract. I was successful in turning the nucleus and so could get access to the posterior plate of the nucleus directly to the phaco tip at the pupillary plane. What I have done here is flipping the nucleus 180 degrees so that the posterior plate comes to lie in the pupillary plane. Then I thought, why not try this in other cases? I tried this in a grade 1 cataract. It worked well. I didn't even need a second instrument. Looking at the slow motion of this grade 1 cataract again showed the ease with which I was able to do a phaco somersault. Encouraged by this, I tried in another slightly hard grade 2 to 3 cataract. Here also, I could do it successfully. I had no difficulty in doing the phaco somersault, and I have noticed that I have accidentally mastered another technique of doing phaco emulsification without a second instrument. Let us see how it is done again. Catching hold of the edge of the nucleus at the equator, the nucleus is maneuvered in the pupillary plane for easy emulsification. Let us see in slow motion. Once the hard part of the cataract is emulsified, the rest is easy. Care is taken not to come close to the corneal endothelium. The key to these maneuvers is to have good capsulorhexis. One more prerequisite for phaco somersault is to have a good hydrodissection and hydrodelineation. I avoid doing phaco somersault if the hydro procedures are not proper and if the nucleus is not freely mobile. Now I have chosen another grade 3 cataract. After doing good capsulorhexis, hydrodissection and hydrodelineation, little debulking is done of the central core of the cataract that does not need any second instrument. The nucleus is rotated and made sure that it is freely mobile. Once this is achieved, an edge defect is created at the equator of the lens, and the nucleus is caught at the bulk adjacent to the defect, and then phaco somersault is done. I used another of my innovation, the ninja chop. A combination of my ninja chop and phaco somersault without the second instrument made my phaco emulsification easy. Once we get to break the cataract, the rest of the phaco emulsification is completed quickly. This is a slow motion to show how the nucleus is caught at the equator adjacent to the break created at the equator. Once this is done, the ninja chop and then the somersault without the help of any second instrument is accomplished all in one motion. All this is happening away from the posterior capsule at or just above the pupillary plane. There is no or minimal risk to the posterior capsule. I have noticed that the effective phaco time and the effective phaco energy used is less with this technique compared to other techniques. We should avoid doing phaco somersault in cases where we suspect that the zonules are weak and in pseudoexfoliation cases. The advantage of this new technique that I have developed is that it can be done in all types of cataracts. There is less phaco time, very less phaco energy is used, and it's a useful technique to access the posterior plate easily, thereby minimizing the risk of posterior capsular breaks when we go close to it. Phaco somersault. Thank you.